Hello, today I will be doing a presentation which is titled Addressing Mental Health in Adolescence. Some of the things being discussed in this presentation includes the challenges, the treatments, as well as some of the ethical considerations of this particular population. With this specific population, the age range is between 10 to 19 years. A lot of the focus is on those between the ages of 13 and 18, where there are many mental health issues. Why adolescents matter. There is a very critical development stages that are involved with this age group. Some of these include emotional, psychological, and social changes. They also have higher vulnerability to mental health challenges. That is due to some of these developmental stages as well as other factors. And they also have the opportunities for early intervention and prevention. And that's why it's crucial for individuals to understand and see these challenges in this population so that interventions can be put in place to prevent further issues. Some of the key challenges involved with this population includes peer pressure, identity formation, and academic stress. School has always been a very big issue with a lot of kids because not only do schools come with the academics challenges, but you also have the peer pressure of the children that they are around and the other peers and feeling that they want to meet a certain standard just so they can feel that they are accepted. Discussing the prevalence of mental illness in adolescents. Statistically speaking, globally it is estimated that 1 in 7, 14% of 10 to 19-year-olds experience mental health conditions. This was cited by the World Health Organization 2024. Anxiety and depression accounts for the majority of these cases. Of course, back to as what I was recently saying, this is due to a lot of the times peer pressure as well as some of the academic stress. Suicide is the third leading cause of death among those aged 15 to 29 years old. Of course, in this particular age group, it does include some adolescents because it starts at age 15. This was also cited by the World Health Organization 2024. And some of the risk factors involved with these suicides, anxiety, and depression include bullying, trauma, family conflict, academic stress again, and also social media influence. As the years have went by and so much has changed in our lives, we now see that social media has an influence over all age groups, but mostly the adolescent population sometimes due to just once again feeling like they need to be accepted. Next up is some unique treatment considerations for the adolescents. When it comes to developmental sensitivity, treatments must align with their cognitive, emotional, and social development. Because all children grow at a different speed, and some of them have more intellectual advances than others, and some of them are more emotionally mature than others, it's very important to consider each of these when you are doing an assessment or doing any type of treatment for these patients. Parental involvement. Being able to balance the adolescent's autonomy with family dynamics is very essential because they are coming up into a stage where they feel like they need to be able to have an opinion and have an understanding of what is going on with their own treatment, along with also having that parental involvement because it is important for them to have a support system. With confidentiality, it is important that we ensure that we are meeting legal and ethical obligations. And comorbidities often present alongside substance use, eating disorders, and self harm, which are also very common issues that are involved with the adolescent community. There are a number of evidence-based therapies that have been proven to be effective with adolescents with psychotherapy. Some of these include cognitive behavioral therapy, which can be effective for anxiety, depression, and some behavior issues. There also is dialectical behavioral therapy, which is targeting the emotional regulation. Also, it helps with self-harm. Family therapy is good with strengthening communication and resolving conflicts. Group therapy is very essential as well because it helps with peer support and it helps them to share their challenges like bullying and grief. Trauma focused therapy. This is essential for the adolescents that are affected by bullying or abuse. And we also have technology integration. Teletherapy and mental health apps for engagement are essential, and I'm sure that many of the children are able to, adolescents are able to be great from this, because social media is one of the things that most of the kids are into now, and that population of children. So technology is learned at a very young age. So it's usually very a positive thing for them to be able to use the teletherapy, because it is more of the speed of what they are taught now in education. When discussing personal triggers, it's very significant to be able to identify triggers that we all have. In my personal experience, it would be family members that have possibly been bullied, or even family conflict that has been possible once in my life or my childhood or adolescence. We have to be able to understand these, of course, because witnessing adolescents struggle with self-harm and suicide is a very sensitive area for myself. I do work with them, and I find it very essential to understand where they're coming from and to have the background, because it kind of helps you a lot to understand where they are. But it also can be a sensitive area for any of us, just to see these young adults going through such a thing, these young adolescents. For the impact on practice, it could be emotionally overwhelming to see young children go through such, significant things, and having to deal with wanting to harm themselves, wanting to even harm others sometimes. So mental health is very significant for us to understand, but it also can be very sensitive and emotionally overwhelming. And also risk for over identification with patient or avoidance of certain issues. It's easy to avoid something that if it's something that will bother you in a personal way, but it's not good to avoid it if your job and your role is to help the patient. So those are some personal triggers of mine. Some ethical issues in treating adolescents related to triggers include some bias risks are over sympathizing or projecting personal experiences onto patients. It's very important not to do this, because we have to understand where they're coming from to help them, but not to always relate. It's not okay to always relate to a patient, because the job is to try to help that patient. Also, avoidance and dismissal of cases tied to unresolved triggers. Now, this is very significant, because if you have a particular thing that is triggering you, and that topic comes up with a patient, and you don't feel that you can give them the assistance they need due to your unresolved triggers, sometimes it is, of course, better to recommend them to someone that can better help them. Because if you're not helping the patient, then there's no point of you even consulting with them. Ethical challenges. Some of these include maintaining boundaries and objectivity, upholding adolescent autonomy while navigating parental concerns. So, like I said earlier, you do want them to feel that they have the ability to make decisions, but you also want them to know that they have their parental support. So they'll be okay with them being present and being available when they meet them. And managing confidentiality when safety is at risk. So it is very important for them to understand and know in the beginning, before you even start working with them, those confidentiality things that can be broken if there is a risk to themselves or anyone else, and some other things as well. But it's just very important for them to understand those at the beginning of therapy, and not when something happens. Next, we'll discuss a reflection on overcoming or resolving triggers. Some ways and some strategies for resolution include self-reflection. So regular self-assessments and supervision to recognize biases. So that is a very big thing with any particular profession, is to understand exactly what we feel. We don't always understand it in the moment, but sometimes you have to get to yourself and just sit back and actually assess yourself and see exactly what things may have triggered you and what biases we may have. Professional development, it's important to do training in trauma-informed care and resilience, so that you will know exactly what things you should and shouldn't understand, and how you should handle certain situations. Therapy for the practitioner. Addressing issues with the therapist. That is also a significant issue, and a lot of times it occurs, but a lot of times those practitioners don't get that therapy. But therapy isn't just for the people that we see. Therapy is for everyone. Anyone can get therapy, and it's important that everyone understands, no matter the profession, no matter the title, therapy can be essential to us all. Peer support, collaborating with colleagues to process complex cases is very significant as well. As a therapist, may need to collaborate with the psychiatrist, collaborate with some of the other therapists, and other different forms of help. Even sometimes you can, do any type of collaboration with a peer, if it feels like that's something that's going to be helpful, maybe in a support group. Also, commitment to growth and recognizing triggers and opportunities for personal and professional growth. everyone has the ability to grow. No one knows it all. No one has it all. So being able to understand that you can always grow and you can pick up on different opportunities to learn more. You can get different type of learn different modules, get different type of certificates. Some of the things that we've done in this class that can actually this course that can actually help you become greater and understand more about yourself as well as patients. In conclusion, adolescents are a vulnerable yet resilient population, and they require individualized care. Regardless of what another patient at the same age and the same race and some of the same diagnosis may have felt what had been helpful to them, doesn't mean it's going to work for another patient. And that's why it's very significant that each patient deserves and has an individualized care plan and is individually cared for so they can get the support and care they need. Understanding and addressing personal triggers enhances ethical practice and patient outcomes. It's very important that all healthcare professionals know what their triggers are and know what things in ethical practice are significant and important. So again, the patient can get what they need. And finally, in conclusion, by prioritizing self-awareness and professional development, PMH&Ps can provide compassionate, unbiased, and effective care to adolescents. And these are the references. Thank you.